According to the World Health Organization, malaria is the world's most deadly vector-borne disease. In 2019, there are 229 million cases of malaria, 400,000 deaths, in around 87 countries. In fact, sub-Saharan Africa itself carries 94% of total cases and accounts for 93% of total deaths. In partnership with Dr. Aisha Aliou, the Nagari Medical Clinic and Maternity Ward, and Leadership Initiatives, we have designed a public health campaign that will make a difference, that will educate Nigerian residents, and that will contribute to eradicating malaria. Thank you all for being here today.
In our presentation, we will be going over meeting the team, what is malaria, the malaria life cycle, overview of Bauchi, Nigeria, determinants, considerations, current strategies, treatments, proposed intervention, funding, reflections, and finally, sources.
Okay, this is an introduction to our team. I'm Susan Meng.
I'm Shimai Kukarapu.
I'm Kaylin Gida.
And I'm Jacob Songkwon.
So this is like an introduction to what malaria is before we get into the details of the treatment methods and the campaign. So it's basically a disease where you are infected with a parasite when you are bitten by a female mosquito who is infected by the parasite Plasmodium. And at the very top, you can see some common symptoms that you're going to experience if you are infected with malaria. And the biggest one is probably intermittent fever. That's what a lot of doctors in Nigeria use to identify malaria, actually. And then below that, you have risk factors. And these are things that are going to increase your risk of being infected by malaria. So stagnant water, it's where few mosquitoes lay their eggs. Bushes around your home, that's where mosquitoes breed, not closing your windows and not sleeping under a mosquito net. And some consequences, these are things that if you don't get effective treatment in time, so like if you don't go to a clinic or a hospital, you choose to see an herbal doctor instead, it may lead to more severe symptoms like jaundice, kidney failure, or even death. And there's actually a statistic by the WHO in 2019, over 400,000 people worldwide died from malaria.
The most common way to contract malaria is through the bite of an Anopheles mosquito. And here is how the malaria parasite infects the human body. So the Anopheles mosquito bites a human being and transmits the malaria parasite into the human being. When the malaria parasite enters the human being, it is in the form of a sporozoid. A sporozoid is the infecting form of a parasite. The sporozoids travel through the liver and infect the liver cells. Over here, they mature into merozoites, or the reproducing form of a parasite. These merozoites travel through the bloodstream and start infecting red blood cells. They destroy these red blood cells and multiply into multiple daughter parasites. As this happens, the patient starts to experience the many symptoms of malaria, like intermittent fever. If enough red blood cells are destroyed, it can also cause anemia. When a mosquito bites this human being, the whole cycle restarts again.
And this is an overview of what malaria is like in Nigeria currently. In 2008, malaria cases were estimated to be over 32,000, but as you can see from the statistic, it's increased a lot more. Nigeria accounted for 23% of malaria deaths worldwide in 2019, and 60% of patients who visit hospitals have malaria, so it's pretty obvious that it is going to be one of the more common diseases you'll be seeing in Nigeria.
Here are the key social determinants of health. First, we have formal education. In Nigeria, about 10.5 million children do not go to school, causing a lack of knowledge about basic hygiene, prevention, treatment options regarding malaria and other diseases. Two, we have economic stability. Given social and cultural norms, individuals will often choose not to go to the doctor even though they are severely sick. Oftentimes, they will choose to go to a herbalist instead. Third, and lastly, we have because of the animosity and social stigma towards Western countries and Western medicine. People choose to see an indigenous healer who tends to be more trusted in some communities rather than going to a clinic with Western medicine.
Okay, and these are some of the considerations that we have to think about when we're talking about educating people in Nigeria about going to clinics and hospitals instead of herbalists. Um, a lot of people in Nigeria believe that the reason they're sick is because of evil spirits, and sometimes even because it's really hot, so there's a lot of heat. And they also don't trust clinics or hospitals because they know that they use a lot of Western medicine there, and they have a lot of animosity against Western people because of imperial and capitalistic roots, and they prefer to go to herbalists oftentimes because it's affordable too.
So these are two big current strategies. And first of all, the WHO Global Technical Strategy for malaria was adapted in 2016 as a result of very high cases in 2015. And their three goals are to reduce global malaria mortality rates by at least 9%, reduce global malaria cases by at least 9%, and eradicate or eliminate malaria from at least 35 countries, all by 2030. And similarly, the CDC, their operations in sub-Saharan Africa, they focus mainly on research and intervention. And what they're trying to do is really research different insecticide-treated net trials, ITN for short, and they test various vaccines and anti-malarial drugs. And one factor that sort of gets overlooked in terms of malaria treatment is developing interventions to protect pregnant women and their fetus, because if a pregnant woman, as stated earlier in the last presentation, they're immunocompromised, and so they could actually this can result in them losing their fetus as well as making the pregnant woman sick. And just to move on to some treatment options for uncomplicated malaria, which is basically a less severe type of malaria, the WHO standard recommendation is artemisinin-based combination therapy, or ACT for short. And artemisinin is essentially a derivative of the Artemisia annua plant. It's a green fern. And an example of this ACT drug would be artemether and lumefantrine, which has the commercial name Coartem. And for complicated malaria cases, which would be accompanied by anemia, kidney failure, or typhoid fever, the conventional treatment method would be IV or IM, or artesunate or IV quinine, and ACT, of course, is a standard, so they'll prescribe that once or better. And just to add on to that, IV quinine is actually, is used after World War II, but it's not really used anymore due to more drug-resistant parasites, as it's been used for a long time. And this leads on to my next point, that we should also avoid monotherapy to restrict the spread of resistant parasites to artemisinins. And so in terms of vaccines, the University of Oxford has the most promising vaccine to date that is now in phase 3, or their last stage of clinical trials. And their vaccine is proven to be 77% effective and expected to be licensed for use by 2023.
So our proposed intervention is an educational workshop, and for this workshop, we plan on gathering 25 residents from Bauchi, Nigeria, who all speak the same language, so everyone can properly understand what is being said. Over here, an ally representative will be speaking on our behalf, and they will be educating the residents about the symptoms of malaria, the accessible and proper treatment methods, and because it is our ethical responsibility to do so, they will also be teaching them about the prevention methods. The first thing the participants will be doing is taking part in an interactive pre-survey. For this pre-survey, the speaker will be asking several questions, and the participants will be raising their hands and answering these questions. This is done so that the speaker can have some background knowledge on how much the participants know about malaria. During the workshop, the participants will be provided with donuts and water. As the workshop concludes, the presenter will ask post-survey questions. This is done to encourage information retention and encourage the participants to spread their knowledge through word of mouth. After the workshop, everyone will be handed educational malaria pamphlets. We are printing extra malaria pamphlets so that the participants can give them to other people they know to spread the message even more.
And to elaborate on what Shumai just said, intervention activities, the main one is going to be the educational workshop and community awareness with the distribution of pamphlets. Program implementers is going to be the LI staff and representatives in Bauchi, Nigeria. Target populations, we want to welcome more parents and adults because they're going to have an easier time understanding everything, and hopefully they can pass the message on to their other friends and family members. Required partnership will be partnering up with the LI team in Bauchi. Potential challenges would be it requires community cooperation and involvement, and there could be a lack of resources.
So for our funding, we are requesting $20 for donuts and water to all of the participants. And we will also be printing 40 pamphlets. There is an extra 15 so that the participants can distribute them to other people they know. So this will be $14.60. So we are requesting a total of $34.60 to implement our campaign.
Some key takeaways of our presentation is that we really want to aim to educate individuals in Bauchi specifically on correct treatment methods as well as preventive methods to hopefully save some lives, and especially make the community feel more assured about if they get the deadly disease, or if one of their family members gets it, they know what to do and they're prepared. And it's also important to consider the ethical considerations, and the perspective that we have is a more Western, we're from a more privileged and Western position, and we really do not understand truly the hardships that the individuals in Bauchi face on a daily basis. And so we really have to consider those aspects. And so all in all, our role in Bauchi is to really advocate and educate in developing in Bauchi and provide malaria learning resources. So hopefully they can all learn more about malaria.
So these are the sources we used. And in case you guys want to contact us, these are our emails. Thank you.
I got you. Thank you, Marshall. I want to commend the team. It was very impressive. From the moment you started with giving the situation, you drew me into wanting to know more about it. The amount of research you did was outstanding. I was really impressed with the way you explained the life cycle and how simple it was to understand the concept, even though it's very complex. So I just commend you for excellent work. The one question I had, I heard someone say something about the number of cases in Nigeria are increasing. Did your research bear out anything regarding the changing climate causing that? Or is it just the lack of people getting treated?
I think it's more about the lack of people getting treated.
Okay, very good. And I just want to close with a super job, very impressive quality of presentation, the materials you developed. Just superb, great job. Thank you.
Yeah, guys, amazing work. Owl, I'd love to hear your thoughts next, please.
Okay, well, I just will have to add up to what Jim have said, because he have already said it all, okay? Because your introduction is so amazing. That was what took me off. You started with giving a statistic of what these issues are in figures, that is supportive figures. This shows that you guys have done your research. And the entire presentation is well organized, and I believe they well coordinated. You started from telling us how you get contacted. One can contact malaria. You break down the life cycle of malaria. You talk about the impact, what it does to the body system. Then you talked about the system, the treatment. In the treatment, you didn't just talk about the treatment. You also were particular about the drugs that are more effective in treating this kind of malaria here. which is really, really amazing. And you also now move to prevention, how one can prevent himself from getting contacted with this malaria or break the cycle of malaria so that one doesn't get infected again. And then you now talk about your campaign. Another closing, amazing closing, is the breakdown of your budget. How you actually break down the whole thing. Okay, this is going to this and this is going to that. Like I said in the previous business section, YDP judgment, every donor is really interested in knowing how every cent is spent. And you have put the mind of the donor at peace by giving them the breakdown of how that money is well spent. So well done, guys. I just lack words to just say you have done an amazing job.
Thank you so much, all. Guys,
Yeah.
Incredibly impressed here. I think you showed what we had in a vision for what students could achieve, not only with the grant, but working on these presentations and showing how you can change lives. You hit every aspect of it. It doesn't matter who the person is. I think if anyone ages 8 to 80 could watch this, they would actually understand what you're saying. It was so clear and well thought out. And you went from step by step to the ethical issues, to the cost issues, to even with the donuts showing the human aspect of making sure that people listening to your presentation were entertained. You hit everything on the money. I could not be happier with your presentation. To people watching this video, you can learn more at the LI website, which will be lichange.org/summer/2021, and you'll be able to see this team and everything they're accomplishing. Once again, guys, a round of applause.